We're on the air.
Less than a minute.
Okay.
Someone might show up.
Is Tim on the dials, or is that Julie?
There it is, 5 o'clock. Welcome, I'm Tyler Ward. With me are Bonnie Tucker and Bill Kennedy, fellow select board members. We have Nicole McStay, our town administrator, and Justine Hansen, our assistant to the town administrator. Assistant? Yep.
Yes.
To the town. Still the same as last meeting, right? Tim Bresnick's behind the scene filming this for the archives, and we're on air. You know, so all that stuff. Tonight's agenda, we have Ed Walker here, Chief Ed Walker. We're going to talk about some ambulance fees. Danica is not here, but we have Tricia with us to talk about Brownfields grant opportunity. That's exciting. There's plenty of those around, right? Brownfields. We'll follow up on a water abatement inquiry from our last meeting. We have minutes from December 4th to possibly approve. Most of us know each other in the audience here, but if you do have a question, just raise your hand and state your name for the record when called upon. With that, Chief, welcome.
Thank you. Slide up here to the front row. Thank you. So we're here to request an increase in the ambulance billing rates. So the last time that we increased our ambulance rates was in 2024. We looked at it at the beginning of this previous year, but there really was not a significant change in either the value that Medicare CMS applies to the region or other stuff, so we didn't do it. The main driving factor now, as you may remember, over the course of the last, two and a half years, there have been an enormous amount of discussion within the legislature around ambulance billing. The bill that passed through the New Hampshire legislature and was signed by the governor set a temporary minimum payment of 325% of Medicare or whatever the ambulance service bills, Medicaid, which, or what the ambulance service bill, whichever is lower. So during this period, which starts January 1st, all the ambulance services are required to enroll or attempt to enroll as a provider with the 17 insurers that are in the new state of New Hampshire, because those are the ones that the New Hampshire Insurance Commission has control over. So as you see the rates on the board in front of you, these were prepared by Dennis Allen of EMAX Medical Billing, who does a phenomenal job for us. The current fees in that first column that's highlighted. You have the Medicare ratio, our proposed fee. It shows what the Medicare fee is, and then your ratio. The other things that are interesting to look in there are the national and the New Hampshire average. You know, one thing that, you know, when you look at sort of the New Hampshire average and where that is, something to keep in mind is we are only eligible to actually receive about 49% of what we bill. So when you look at what is statutorily written off by Medicare, Medicaid, by CMS, or other stuff, we're only at about 49%. We collect about 43% of what we bill. So you look at, you know, we're only eligible for 49, we're collecting 43. We're in the high 90s as to what we're, collection of what we're eligible to receive, not what we bill. So one of the problems that you have is, particularly with Medicare or Medicaid, we can charge whatever we want. They're going to pay us what they're going to pay us. So the other risk you have, and a lot of your national insurers, they'll respond that, well, your rates are unreasonable, and they'll offer a different amount, and then we get into a battle between the resident here who is the insured and what their responsibility is and what they say is fair. So that brings me to the other thing that's nice about this is going forward, we have this dollar amount, which is in that proposed fee column, second from the left. That is really what the New Hampshire legislature has said is a reasonable amount to bill. So now when you look at those national insurers, it's what they say, hey, you're billing too much. we can turn around and say, well, we're billing what the state of New Hampshire through the legislative process said is a reasonable rate for us in doing that. So as we look here, you know, we have that. So it looks like, you know, some things are larger jumps than others. But it's, you know, again, it's based upon what that Medicare rate is and the Medicare ratio of 3.25 or 325%. So fairly straightforward, but again, it doesn't mean we're going to get 325% more revenue from the ambulance service. You know, I think that's important to remember, because that Medicare rate and that Medicaid rate is still what we're going to pay by all of our Medicare and Medicaid patients.
Which is what percentage of our patients?
70 something,
yeah.
yeah, it's a high
I know it's over
percentage.
70.
Yeah,
Medicare
it's Medicare and Medicaid when you
Yeah.
look at, you know,
Yeah.
the number of folks. And it's not just in Peterborough. I mean, our area, you know, Dublin, Hancock, they also have a lot of retirees and folks that are older. And, you know, you have some, you know, a lot of the residential facilities are around, and some of the other communities we go to that have the Medicaid patients too. So it's important. Don't think, you know, if you're listening at home, don't think, oh my God, we're going to get, you know, 325% more money in the ambulance revenue next year. We're not. We're now positioning ourselves to negotiate with those 17 insurers in the state of New Hampshire to move this forward.
So the private payers.
Correct, the private payers, yeah. And then again, that's the big risk we have with, you know, if you go super, super high, now you're forcing these payers to pay the difference between what their insurance company pays, and you're really throwing that back on, you know, disproportionately almost back on some of those patients.
And where is the conversation now in terms of balance billing?
So if the 325, it prohibits balance billing from the New Hampshire insured provider. We can't balance bill Medicare and Medicaid patients. We can collect through a Part B or a supplemental, but we can't true balance bill for them. What this will do is because we are getting that 325, it prohibits us from balance billing. But if we're getting that 325, we're getting our current fee, so there's no need to balance bill. So I guess what I would ask is that the select board adopt these proposed fees as demonstrated in the second column from the left to be effective on January 1, 2026, because that is when the legislation becomes effective.
And if we do that, your next step then is to approach all the various services?
Yeah, so the state actually has made a consolidated application.
Oh, okay.
The Insurance Commission has a webinar tomorrow for ambulance companies to help get us through that process. Dennis is also working through it. He represents a number of ambulance companies, so he's providing some of the data for us and everything. But they've, in their eyes, streamlined the process for us. But there's a webinar tomorrow that will help explain some of that.
Okay. And you've been handling this project yourself?
Jeff Fahey's been doing, Jeff Fahey and Dennis have been doing the lion's share. A lot of credit goes to the New Hampshire Ambulance Association, working with the Fire Chiefs Association and a few others to really create a process that would be friendly to us, because again, you look at, you know, we're a medium-sized service. A lot of services are a lot smaller than we are, and having the resources, again, the consolidated application is one thing. We don't have to apply individually to 17 different insurers.
Right.
We just have to do the one application. So.
Have you gotten any feedback from Dublin?
We did get Nicole has spoken with the Dublin Town Administrator at a conference a little bit. We're going to be meeting with whoever, a member of the Dublin Select Board or whatever, after we get a letter to them. We're going to get them some preliminary data and sort of to refine that conversation. We don't want to walk in a room and say, what about this? Oh, we did, don't have it in front of us. So we're getting information back. I think and correct me if I'm wrong, but I think from Nicole's conversation with their town administrator, it's more really wanting to have a clear understanding of what that process is, how we arrive at what we arrive at, and really are we doing our due diligence to make sure we're being efficient both in our operation and our billing and our recovery, because it does impact them. Is that a fair?
And also to understand, they have 3 relatively new board members, so also to understand what is the service that's being provided to them. What was the contract process, when we did it 10 years ago now?
Mm-hmm.
And
in this room.
Yeah, yep. And, just to really get it in that conversation.
Yeah, I'd heard some grumblings.
Yeah.
I did have a conversation with one of the members from the budget committee in Temple, again, sort of getting the historic perspective and looking at that, and he was appreciative of it, and, at some point in time may ask us to come back. When we were, when Temple was looking to leave Wilton as their ambulance service and looking potentially to move with us, we presented a presentation and sort of outlined everything. He feels it may have been long enough that it's time to do that again for people in the budget committee, select board, and the resident. As you know, the residents that pay attention ebb and flow and they change, so he thinks it might be valuable to have that presentation again. So maybe going over to Temple also.
I have 2 questions.
Oh, yeah.
Yeah. One is, for these rates, has there been any, these proposed rates, has there been any assessment on, from a private pay, the national insurers, impact on patient co-pay, co-insurance, impact on the patient?
Not really, because that comes down to sort of, in our view, it comes down to sort of individuals and what their insurance is, unless we know exactly what, and even when we bill somebody, our insurance company really doesn't have an understanding of whether it's a high deductible or how that's going. If, someone could have a super high deductible plan, I've already met their deductible, so the insurance company pays all of it. They don't necessarily know those things. The one thing that is true, as you say, if you have somebody who is privately insured, with this rate, they're going to be responsible for the whole thing. So whatever their insurance company doesn't pay, typically they can look to, they're responsible for. Something to keep in mind for anybody that we transport in the ambulance, we work closely with Monadnock Community Hospital for hardship consideration. So Monadnock Community Hospital has a formula that their billing department uses to assess an individual's ability to pay for medical care. So it can go from 25, 50, 75 to 100% off of your bill. Monadnock Community Hospital will work with patients that we transport even if we do not transport them to Monadnock Community Hospital. So if we have a member in the area here, Monadnock Community Hospital will do that financial analysis to help determine their medical eligibility, or quite often if it isn't Monadnock, the hospital they're transported to will do the same thing, because chances are, although these numbers are pretty big, if you wind up in an emergency room or inpatient, it's unfortunately a small fraction of what your costs can be over that period of time. Yeah.
The other question I have is, do we have a sense for proportionately when we are even looking at the current fee, but also at the proposed fee, from a national pay or private pay perspective, what proportion or percent of the time do we actually get that reimbursed at that
I don't
level?
actually know. We could, I know we could get that number.
So we do get those.
Yeah, we have that, but I don't have it off the top.
reports.
I don't have it off the top of my head, but yeah, that's a number we could get. I don't know.
Because I think that,
Yeah, I mean, so, again, going back to that, if you look at, we receive, if we bill $1 million, we're eligible for about $490,000, we receive $430, so, $430 or $490, we're looking at pretty high, 90-something% of the money of the eligible money we recover, whether it's through insurance companies or through co-pays or, patient responsibility.
I know that most of the time when we do receive the full amount that we bill, it's because of motor vehicle accidents. More than anything else, it'll be a car insurance company that's paying it, not a health insurance company.
all right, thank you.
Chief, a couple of the lines are, we're half of the New Hampshire state average, line 2 and line 4, the two non-emergency
Yep.
lines. Why wouldn't we at least bring them up to, why wouldn't we be closer to 100%? Why are we, is there a reason we're not charging more in those?
I'd have to look, I'm trying to follow across, so I'm trying to go downhill
Yeah, that's
across.
like-
So,
Yeah, sorry.
Yeah, like that's almost half of what the New Hampshire average is. Yeah.
So we typically no longer do non-emergency, because that's your medical transfer, like hospital to hospital or hospital to rehab or something. All of ours are the emergency rates, because we're doing all the 911 calls and stuff like that. I don't know what the answer to that is when we're looking at that. Again, in line with the fact that most of our patients, highest portion of our patients are Medicare, Medicaid patients, we're only going to be getting what is in that third or fourth column anyway, as opposed to the full billed amount, but I can look, I mean,
Most of the time, if it's not medically necessary, we don't get reimbursed for it
Yeah.
anyways. It'll just get rejected out of hand.
that is especially with any patient covered by CMS, so your
Yeah.
Medicare and Medicaid patients. And their threshold was another method of transport available, it's whether it was another method of transport appropriate.
Yeah.
So you fall down in your house and break your arm and can't drive yourself to the hospital because you own a standard, it doesn't matter. They could have put a sling on your arm and had somebody else drive you, they're not going to pay. You're fighting to have Medicare or Medicaid pay that bill.
Okay, any questions out there? All right, I'd make a motion to accept these new fees as recommended.
Second?
All those in favor? Aye. Yeah, thanks.
Thank you very much, appreciate it. I will, we'll let EMAX Medical Building know.
Yeah.
Good.
Yep,
Yeah.
all right, appreciate it. Thank you very much, guys.
Yep.
See ya.
Thanks for coming.
Good luck.
All right, next up, our Brownfields.
Yeah.
We still have some left in town, huh?
Yes. Yes. I have a list in case you're wondering.
Yeah.
But basically, from what I understand, is that the Southwest Regional Planning Commission is partnering with the Monadnock Economic Development Coalition, I believe it is. Corporation, there we go. To apply for this grant that would amount to about 1.5 million. And part of this ask is that they're requesting that a letter from the select board to Southwest for Peterborough to be a non-lead coalition member. So that just means that Peterborough, along with Winchester and Keene, hopefully will just have a seat at the table if this grant, if they receive this grant, so that they can help with the process of choosing Brownfields to receive money.
So we're not, okay, so this isn't specifically for our Brownfield.
Correct.
It's being ready if and when that money's available to then apply again for those
Yes.
specific Brownfields.
Now, having said that, we do know of a number of them, as you indicated, one of which is one of our projects that will be coming up very soon, which will be the fire station on Summer Street, once we've vacated the premises. It'll be good to have some funds available to assist us with the cost of doing a Phase 1 environmental assessment of the property as we move to
Right.
put that on the market.
Yeah, yeah, and there's a lot of interest in that property
Oh, yeah.
because it's so close in
Yes,
from a housing or mixed-use perspective.
yeah. The density you can get on that property is, that makes it
Makes it
really
very attractive.
Very attractive,
Yeah.
There's actually a lot of property there, but a lot of it's uphill.
Yeah,
Mhm.
yeah, which is what adds to that density bonus.
Yeah.
Yeah, great. Okay. Are we need a motion or we're just giving a blessing?
Just, yeah, we'll need a motion to,
They're requesting a letter.
yeah,
To participate.
to support for the
Yeah.
grant, to support the grant proposal as a non-lead coalition member.
Mhm.
Great.
So moved.
Excellent. I'll
Second.
second. Bonnie seconded it.
We should have seconds
All
and
those-
thirds, right?
All those in favor?
Aye. Thank you.
Thank you.
Yep.
Yeah, thanks, Trish.
Well done, Trish.
Thanks.
Great.
All right.
Okay.
Seth's not here to explain all this.
Seth is not here to explain all this. I'm going to do my best to fill in for Seth.
Yeah, we
We
had
had
it in
the-
our package.
yeah,
right?
Exactly.
Yeah.
We were able to read it.
Right.
Yeah. Do you have any questions about Seth's memo or the information he gathered?
I thought it was, go ahead.
You-
No, I thought it was very
You
clear.
start.
Yeah, so what we had specifically asked for was to investigate the question about whether air could substantially move the meter. Because the question was, what could have caused that level of flow through the meter that is much higher than what you would normally experience in any other quarter before or after. And so we wanted to make sure we were being very thorough in the assessment. So what I took away from this memo was that the air could not have had a material impact as a result of this investigation. That's what I took away.
Same.
Okay.
Same here, yeah. Mhm.
It's really unfortunate that Mike had experienced this issue, but I can think of no other reason for it other than,
Well, one thing, and Nicole, I don't know if you want to talk about this, but one thing that I don't think really was mentioned, but was in his email, was that there was a flapper that got repaired or replaced
on the toilet. Right.
on the toilet
Yeah.
during that time. So,
Yeah, so this was sent on August 14th, and Mike included it in his packet of material for the select board. And he says very clearly in there, I replaced the flush valve on the other toilet in August of 2023 as it was leaking, it's not leaked since. I just replaced the flapper on it today, as my daughter informed me this past Sunday that the chain had broken. So it was a defective piece of plumbing equipment, which he repaired shortly before sending me an email in August, so that would have been after this billing period had closed. So, the only thing we can assume is that it had been probably broken for a period of time. It had been leaking all the way through.
But even without an assumption, there's no way of knowing any other reason for it, or either. It could have been a garden hose, could have been any.
Could have been any number of
Thing out there.
things, yeah.
And they may very well and probably were not even aware of it. So, I did see something in Seth's information about the volume that can come from a leaking toilet,
Oh,
which was
yeah.
kind of shocking.
It is
So-
shocking amount of
And
water.
if it's a trickle, over weeks or whatever, it can totally be unnoticed.
Yes.
So, yeah. Okay.
So the message of the day is check your toilets.
Yeah.
Yeah, yeah.
Yeah, I think it's right here. So the volume recorded reflects a sustained flow of water. For context, a continuous undetected flow of only 0.18 gallons per minute over 3 months would produce the same total usage. And that could very
Yeah.
easily flow through a toilet without anyone noticing.
All right.
and I think that coupled the finding about the air not being able to materially move the meter, and that coupled with both, with the testing of the meter he had in place as being completely operational. I don't think we have any basis upon which
Too bad.
to abate.
Yeah.
So do we need a motion to deny?
Yes, a motion to deny the abatement request.
So moved.
I'll second that. All those, any questions? All those in favor? Now, this was a small amount of money, and we realized this, we probably shouldn't have made a big deal about it, but I'm glad that there were unanswered questions at the last meeting and that they were answered by tonight, so it's a fair decision. Yeah. Okay. Great. Now, did anybody read those minutes from this
I
meeting?
did.
I did.
Believe it or not.
You too.
I didn't have any changes to it.
All right, I'll make a motion to accept those minutes as written.
Did you see my
Oh,
little note?
yes.
Did you see my
As
note?
amended?
As amended.
Yes, it was just a clarification for the piano.
Hmm.
Yeah.
I just wanted to make sure, the way it was written was Kathy Lanigan
Mhm.
from the Monadnock Choir was saying that,
Yep.
yes, anytime the piano would be used, people would save $3,000. I just wanted to make sure it was clear that it would be any time the piano needed to actually be moved
Mhm.
from the stage to
Yep.
the floor.
Or vice
Yep.
versa.
Or vice versa, because otherwise the piano will be on the stage and probably use a
Mhm.
lot on the stage. So I just wanted to make that clarification. Otherwise, I'm fine.
Good amendment. All right, is that it? Bad. Happy Christmas, happy holidays.
Make a motion to accept the minutes as
Happy
amended.
Hanukkah. We did.
I thought we did.
Did you?
Did we?
All those in
Okay.
favor?
Aye.
Great. Now we're done.
You motion?
I motion.
I second it.
Okay.
It was in my mind, but I seconded it. Oh, yeah, sit with it as amended, okay. Great. Thanks,
Motion
everyone.
to adjourn.
Motion. Second.
All those in favor?
Beat you to it.
You did.
It's my favorite motion. Do you know any really good flooring guys?
I do.
Yeah.
I do. Well, I mean, I don't